The chair recognizes the gentleman from Scott for opening remarks on House File 626.
Thank you, Mr. Speaker. House File 626 prohibits health insurers from switching a covered person's prescription drugs to a less costly alternative or increasing the cost of the drug on the covered person when the individual is stable on the drug and their health care provider continues to prescribe that same drug. There is an amendment, Mr. Speaker.
There is an amendment. The clerk will call up the amendment.
H1068 by Mohr of Scott.
The chair recognizes the gentleman from Scott for opening remarks on H1068.
This amendment, Mr. Speaker, makes the whole bill possible. This is a compromise amendment between the insurers and advocates for this bill. The amendment strikes definitions, clarifies that these requirements apply to through the last day of the health benefit plan year, and strikes paragraph 3 of the bill. Questions?
Is there discussion on the amendment? Seeing no discussion, the chair recognizes the gentleman from Scott for closing comments on H1068.
I move the amendment, Mr. Speaker.
The gentleman from Scott moves amendment H1068. All those in favor of its passage shall say aye. Aye. All those opposed shall say no. The ayes appear to have it. The ayes do have it. The amendment has passed. We are now on House File 626 as amended. Is there discussion? The chair recognizes the lady from Polk, Representative Srinivas.
Thank you, Mr. Chair. This is a really, really good bill. As a physician, I see the implications of having medical switches that are not necessary or even good for my patients every single day. This bill fixes that and gives us a way to protect our patients and protect Iowans. I want to thank Representative Tom Mohr for bringing this forth so many years in a row until we could finally get this done, and Representative Gary Mohr, who has championed this session and helped to make this possible. So I really urge everyone to vote for this to ensure that we can really protect Iowans. Thank you.
Seeing no further discussion, the chair recognizes the gentleman from Scott for closing comments on House File 626.
Thank you, Mr. Speaker. I want to thank, this bill is possible. It's been introduced 5 or 6 times, Representative Mohr. It's a good bill. It helps Iowans. And I want to thank the insurers, the users groups, Representative Srinivas and Best, who are the subcommittee. And Mr. Speaker, I move the bill.
The gentleman from Scott